Hello everyone, welcome to this YouTube video on Prodrugs. If you find the pace of this video to be slow, consider increase the playback speed to 1.5x for improved audio quality. So, have you ever wondered how a medication can go from inactive form to active form in your body? That's where Prodrugs comes in. In this video, we will explore different types of prodrugs, how they will work, and their advantages and disadvantages. We'll look at some examples of prodrugs currently on the market and discuss their applications. So whether you are healthcare or a healthcare professional or just curious about the world of pharmaceutical, you are in the right place. Let's get started. Prodrug is a precursor of a drug that is designed to undergo a specific chemical or biochemical transformation in the body to release active drug. Prodrug can be designed to improve the pharmacokinetic and efficacy and safety tolerability of drugs. Improved pharmacokinetics. Let's start with improved pharmacokinetics. Prodrug can help to modify the pharmacokinetic of a drug by altering its bioavailability, distribution, metabolism, and elimination. This results in increased drug efficiency and reduced toxicity. Enhanced targeting. Prodrugs can be designed to target specific tissues or organs, increases the drug concentration at specific action and reducing off-target effects. The third thing is increased stability. Some drugs are unstable or prone to degradation in the body, limiting their effectiveness. So prodrug can be designed to improve the stability of the drug, ensuring it reaches to its intended target to an inactive form. Patient Improved patient compliance. Prodrugs can be formulated to improve patient compliance by increasing convenience and ease of the administration. For example, a prodrug can be designed to be taken orally rather than through injection. Masking bitter taste. Some drugs have unpleasant bitter taste which can make them difficult to administer. So prodrug can be designed to mask the bitter taste of the drug, improving patient compliance. Overcoming the absorption barrier. Some drugs have poorer absorption due to physicochemical properties or the presence of efflux pump in the intestinal epithelium. Prodrugs can be designed to overcome these barriers, improving their drug absorption and efficacy. Controlled release. Prodrugs can be designed to release the active drug in a controlled manner, ensuring a sustained therapeutic effect over a prolonged time. This improves drug efficacy and reduces the frequency of dosing. Reduced Reduced first pass metabolism. Some drugs undergo rapid metabolism in the liver or the gut wall, resulting in the low bioavailability. Prodrugs can be designed to bypass the first pass metabolism and improving the drug bioavailability and efficacy. And improved selectivity. Prodrugs can be designed to selectivity increases the selectivity of the drug for specific target and reducing off targets and improving therapeutic index. Drug combination. Like prodrugs can be designed to combine two more drugs to a single molecule, improving patient compliance and reducing potential for drug interaction. Reduced we can Prodrugs can be used in reduced toxicity also and improve stability in formulation. Prodrugs can improve the stability of drug formulation by preventing degradation and enhancing shelf life, improving drug delivery. So let's understand more. Here you can see that not very active or inactive drug molecule, when you administer it through orally, it becomes active or active metabolite. Here you can see example of procanamide. Procanamide is administered, it is rapidly absorbed into the bloodstream and distributed throughout the body, including heart. It binds to sodium channel in the heart, which reduces the entry of sodium ions into the heart cells and slows down the electrical activity in the heart. So the metabolite of procanamide is N-acetyl procanamide. It is a primary metabolite of procanamide. It is an anti-arrhythmic property. So another example you can see enalapril. Enalapril is actually a prodrug, meaning that it is not an active in its initial form, but when it is metabolized by liver, it converted into enalaprilat, which is an active form. Enalaprilat is converted by the enzyme called carboxyesterases into its active form enalaprilat. Enalaprilat has a longer half-life than enalapril, which allows it to be given less frequently than enalapril. Enalaprilat also has a more potent effect on blocking ACE and lowering the blood pressure. Let's come with another example. Phosphentine is a prodrug of phentoin, which means that it is converted into phentoin in the body. Phenytoin is an anti-epileptic medication that is used to control seizures in patients with epilepsy. And another example is bempedoic acid is converted into active form ETC1002 by the enzyme acyl-CoA synthase. Long fatty acid member ACSL1. Bempedoic acid CoA that inhibits ATP citrate cyclase, and enzymes that play key role in production of cholesterol in the liver. By inhibiting ACA, bempedoic acid reduces the production of cholesterol and help in lowering LDL cholesterol levels in the body. Another example is flucytosine is a prodrug that converted into 5-fluorouracil in the body. 5-fluorouracil is an anti-metabolite that interferes with DNA synthesis, thus inhibiting the growth of fungal and cancerous cells. Once flucytosine is absorbed into the bloodstream, it is rapidly converted into 5-fluorouracil by the enzymes in the body. The resulting 5-fluorouracil is distributed throughout the body, and it is taken up by fungal cells or cancer cells, where it interferes with DNA synthesis and leads to cell death. Another one is capecitabine. Capecitabine also converted into 5-fluorouracil. It shows anti-cancer mechanism of action. Here comes cyclophosphamide. Cyclophosphamide and it is a prodrug that converted into active form phosphoramide, mustard and acrolein respectively in the body. Acrolein is known as causes cell damage to the tissues by reacting with proteins, lipids and DNA, which can lead to inflammation, cell death and tissue injury. It is a particularly toxic to the bladder, where it can cause hemorrhagic cystitis, a painful and potential serious condition characterized by inflammation and bleeding of the bladder lining. And another example is levodopa. Levodopa is a prodrug that converted into dopamine in the brain. Dopamine is a neurotransmitter that plays a critical role in regulation of movement, mood and motivation. In Parkinson disease, the dopamine uh, producing producing neurons in the brain gradually degenerate, leading to shortage of dopamine. This shortage can cause symptoms such as tremors, rigidity, and difficulty with movement. Another example of prodrug is Sucral, sucralfate is a medication used to treat gastrointestinal ulcers, including those caused by NSAIDs, non-steroidal anti-inflammatory drugs. It is a prodrug that is activated by acidic environment of the stomach. And we can see methenamine. Methenamine is a urinary tract antiseptic drug that is commonly used to prevent urinary infections. Methenamine is a prodrug, which means it is converted to active form. It is like formaldehyde in the acidic environment of urinary tract. The mechanism of action of methenamine involves slow hydrolysis of drug in acidic urea, which leads to release of formaldehyde. Formaldehyde then react with amino groups of bacterial proteins, causing them to become cross-link and denature. This ultimately leads to cell death of the bacteria and result in and remove rid of infection. Nitro and another prodrug is nitrofurantoin, is an antibacterial drug that is used to treat urinary tract infection caused by certain bacteria. Nitrofurantoin converted into its active form within the body. The prodrug of nitrofurantoin is not active against bacteria. Once ingested, it is rapidly absorbed into bloodstream and converted into active form in liver. This active form is highly reactive molecule that can cause damage to bacterial DNA and other cellular structure, leading to bacterial cell death. The mechanism of nitrofurantoin involves formation of reactive intermediates like hydroxylamine and nitroso intermediates in the bacterial cells. These intermediates can react with bacterial DNA, leading to damage and inhibition of bacterial growth. Now here comes alpha methyl dopa, is also known as methyl dopa, is an antihypertensive medication that is used to treat high blood pressure. Alpha methyl dopa, since we know that it is a prodrug, which means that is activated to active form within the body. The active form of alpha methyl dopa is alpha methyl norepinephrine, which is an analog of neurotransmitter norepinephrine. Alpha methyl norepinephrine act by decreasing sympathetic nervous system activity, which leads to decreasing heart rate and blood pressure. It does by reducing release of norepinephrine from the sympathetic nerve ending, which decreases the activation of alpha beta-adrenergic receptors in the heart and blood vessels. Thank you for watching this video. If you like this video, hit that like button, share with your friends, subscribe to my channel.